Hi, I welcome you all, especially the NICE experts, 750 of them from all over the country, and the P.O.E.M paramedics. Also, all the staff patients from N.I.C.E therapy. I especially welcome all the doctors, staff, and patients from our newly opened facility, N.I.C.E Jaipur. Today, January 23rd, is Netaji Subhash Chandra Bose ji's Jayanti. So let us begin the day with the ship, and you imagine that you are aboard this ship. There are many other passengers aboard the ship, sitting everywhere that's possible. They're sitting and enjoying themselves. If, however, this ship sinks for whatever reason, it is guaranteed that you shall also sink, irrespective of where you're sitting. So friends, if you want to stay afloat on the ship that you are seated in, you have to take out time to study the ship. We are talking of that one ship where you and I and everyone else is seated in. This ship that we are talking of is our country, Bharat, India. I want to now ask you, to prevent this ship, India, from sinking, what is your role and contribution? Think of how much time you spend on thinking about this country, this ship. In the 24 hours that you have, you go to work, do a job, and if you have a 2-bedroom house, you start planning of a 3-bedroom house. If you have a small car, you start preparing for a bigger car. All this you do for yourself. But I'm talking about the country. If you say that you do a lot for the country, I'm not convinced, because if we look at the condition of the country, its plight, the extent of unemployment and hunger, why does that exist? It means whatever we do is not enough and we need to do more. And what better day to resolve than January 23rd today? If you need encouragement and motivation, I would urge you to read Netaji Subhash Chandra Bose's biography. I'd like to tell you, in fact remind you, and we have Afghanistan's example in front of us. You might be seated anywhere in the country, you might be in the highest position. If the country sinks, your sinking is certain. You might be in the highest post or have a large bank balance. It is your responsibility, your moral responsibility, that you think every day of this country and contribute however little that you can. But for sure, contribute. For that, whatever encouragement, motivation, energy, or bravery that you need, the easiest and best way is to read Netaji Subhash Chandra Bose ji's biography. We all have read about Netaji in school. He was there in our syllabus, and movies and TV serials have been made on his life. But I still insist that you read his biography again. There is a need to reread it. Till 17th of August 1945. I speak of the country's first Prime Minister, Netaji Subhash Chandra Bose. This statement of him being the first Prime Minister must have surprised you. Please do your own research. I am giving you a clue. India's first Prime Minister was declared in 1943. Provincial Government of Free India. And its Prime Minister, it was agreed upon by 9 other nations, including Germany, Italy, Japan. And Netaji Subhash Chandra Bose also declared a currency, as well as a bank. If you don't know about these things, please do some research. But now I want to go a little deeper. 17th August 1945, that was the last day he was seen. In the city of Saigon, which is in Vietnam. It is said and it is believed. It has been broadcast that he died in a plane crash in 1945. And now, today in his remembrance, I want to share some things with you. If there is any other country after India, Bharat, that has impacted me most, it is Vietnam. Many of you are already familiar that in the last 11 years, I have been deeply connected with Saigon, also called Ho Chi Minh. I visit the country very often, interact with its people, get inspired by them, and even teach them. This has been going on for the last 11 years. In this duration, I have had opportunities to visit many other places. Notable amongst them is a war museum that is there. And I noticed in the War Museum, newspapers published between 1945 and 1955 report sightings of Netaji Subhash Chandra Bose. So the question now rises, what is the mystery behind the reporting of his death in 18th August 1945? What is the truth behind this? To know this truth is not only the right of every Indian, it is also our responsibility. We still have amongst us in this country people who are brave and revolutionary, who are involved in unraveling this mystery. The name of one such person is Kanti Mahajan. Kanti Mahajan ji has authored a book, Subhash's Secret. I have met Kanti Mahajan ji several times. Just as you might have questions related to the mysterious death of Subhash Chandra Bose ji, and with respect to the date of his death, so I asked him such questions, and please do give a listen to his answers. Jai Hind, I am Kanti Kumar Mahajan. The brave warrior Dr. Biswaroop Chowdhary posed a few questions to me on the occasion of Netaji Subhash Chandra Boseji's Jayanti. I would like to share the answers to those questions here. 1945 has been announced as the year of his death, and if he was alive after that, where was he? This is a deep and complex issue, and we're trying here to put it across in a few words. Manchuria radio station broadcast 3 speeches of Netaji Subhash Chandra Bose. The date was 19 December 1945. This is officially documented with signatures from an official by the name of P.C. Kar. This document is present even today. So these are 3 speeches given by him after 4 months of his reported death. Now, as to the truth of ashes of Netaji in Japan's Renkoji temple, I have written this book on Subhash Chandraji, and I have raised this issue several times, claiming that the ashes in Renkoji temple are not of Netaji. They are of a British soldier from the Second World War, Ichiro Ukura. We have probed the matter extensively and submitted our findings to the government, but the government has not taken the matter seriously. 28th May 1964, in front of the bathroom of Jawaharlal Nehru ji in Murti Bhavan, the one person standing amongst several heads of nations and prime ministers of other countries, and who was ushered by Lal Bahadur Shastri ji himself from the welcome gate, that was Netaji Subhash Chandra Bose ji. He came in 1964 to Trimurti Bhavan, and I am not saying that. There's a documentary from the film division of the Ministry of Information and Broadcasting, documentary 216B. This is a government documentary. So it's not just me saying this. There are other things that support the assertion that he was alive after 18th August 1945. There is a government document called Bangkok Docket. This is dated 21 August 1945. And it says that there was no such plane crash that occurred. I have reported in my book Subhash's Secret, after extensive investigation and research, that there was no such plane crash. At that time, the pilot of the plane, who was a fighter pilot, Mr. Jaban Jacob, he was alive. So where is the question of Netaji passing away? So this is a matter worth discussing. The second question Dr. Biswaroop Roy Chaudhary asked me, why did Netaji not declare himself alive after the country became independent? 15th August 1947. I would like to alert you via this video. Bharat never gained independence. It was granted independence on the basis of some words in an agreement. One such agreement was that in the next 100 years, if such a person by the name Subhash Chandra Bose were to appear, he would be handed over to America or Britain. This was one of the conditions under which the transfer of power was done. That was transfer of power only, not freedom. So this issue cannot be seen in this perspective, that why a person such as Netaji did not reveal himself after independence. Netaji was a true and proud son of Bharat. He would not like to worsen or disturb the conditions that surrounded the time India attained independence. But Netaji was present And I'm not the one who's saying this, there is plentiful evidence to support this. He was there with Stalin in 1953 and he was there in Pune in 1964. Also led a trade union in China. Many such evidence emerged in the course of research for this book and otherwise. Dr. Biswaroop Roy Chowdhary posed a third question. What is the connection of Netaji's plane crash and the work that he did following that with Vietnam? Absolutely, there is a connection. First of all, I am revealing that this plane crash never happened. We are told that the plane crash happened on August 18th, 1945, but the truth is that the plane crash never happened. Netaji left from a southern city of Vietnam, Saigon, for Manchuria, his hidden home. And rumors were spread that Netaji has died in a plane crash. Japan had surrendered in the Second World War, and it did not mean that in the fight for independence the government would surrender. And the land on which Netaji lived to take his plans to fruition was Saigon, Vietnam. So in the plan and fight for independence, Vietnam cannot be set aside and forgotten. Vietnam had an important role to play. It is from Saigon that Netaji left for Manchuria. In fact, I would go as far to say that we need to have a discussion, an investigation that shows clearly if justice was done with Netaji in this country and in history. These are the points I have brought out in this book, Subhash Secrets. We will try to make this book available in Marathi, English and Hindi. Dr. Biswaroop Roy Chowdhary gave me a valuable opportunity to bring out these points in front of you today. And I am grateful to him for this. And I shall now end my talk. Jai Hind. I believe strongly that we needed Netaji Subhash Chandra Bose ji before 1947, but we need him even more today. The country needs him more today. I am saying this because before 1947, Indians knew two important things. First, they recognized that we were slaves, and second, they recognized the enemy. Today, the unfortunate thing is that we do not realize that we are still slaves. We cannot roam around freely when we wish and where we wish to go. And more importantly, we cannot even breathe freely in the open. That is also a luxury. And the second important thing, we do not know who our enemy is. We think our enemy is a virus. The restrictions that we are facing is because of a virus. It was in January, exactly 2 years ago, that we were hearing of this virus, Wuhan virus, and it was splashed on TV, on media, in every newspaper, day and night. We were reading about just this, of this mysterious, dangerous virus, day and night. Like a scary movie. And we believed that this scary movie was limited only to Wuhan. It was at this time that I informed you through my YouTube channel how this mysterious Wuhan virus will soon be spread all over the world, how this ordinary flu will be given a new name, and how on the basis of a new disease a vaccine will be launched. And a day will come, and how every few months you will be told to get a vaccine and a huge budget will be created for it. And the budget will run for several years. These were the predictions that we made. Those of you who are subscribers of our YouTube channel know that in June, it was probably the first week of June, maybe 2nd of June, when we had about close to 10 lakh subscribers, that channel was deleted and banned. Those who wish to see all those videos that were there in the banned channel can go to the link provided on the screen below and watch those videos. again. At that time, a terror spread through the country. Try and remember when the lockdown was imposed, a long lockdown for 3 months, and we were told anyone could die of this so-called virus. At that time, whatever our resources permitted, we put them together, and together with our 750 NICE experts, we created a support system. And you know that. Let us recall that. That support system was called NICE, and in the first week of June, we launched a phone number 2 years ago. We also shared the link biswaroop.com/NICE. In the entire country, if anyone had COVID or flu or influenza-like illness, had cold or cough, fever or scared, all you had to do was either call us or get in touch with us telling us your symptoms. Many of you, thousands of you did just that. 750 you can call soldiers or NICE experts worked through days and nights. And together we worked, comforted each other, followed the flu diet or NICE protocol, and we even wrote a book on this and got the protocol across to you through this book. This book was bestseller on Amazon for 3 months, and it was banned by Amazon after that. The Hindi edition is still available on Amazon, but it can be freely downloaded through this link, biswaroop.com/ebook. And you can download in Hindi or English, and we will have other languages soon. So in our country, there are 2 kinds of people. One who connected with us and tackled an ordinary flu. Remember, if you catch the flu, cough and cold follow naturally. But if a terror accompanies it, a terror that is spread through television or through a ringtone, a terror that is hammered in your head, that terror can depress your immunity. And in that situation, if you are given a banned drug like remdesivir or plasma therapy or hydroxychloroquine or others, retinol, etc., if all this is given, then there is no big deal if a person dies, and in fact does die. And then it is stated as death due to COVID. But you saw how our NICE experts supported you. So 2 kinds of people. One who helped themselves through connecting with us and with this network. And the second kind learned this technique and treated themselves, empowered themselves with this 3-step flu diet, helped themselves and all their friends and loved ones, and stayed protected and away from hospitals. Whatever reason you may go to the hospital for, they will insist on a COVID test, and if you are positive, will give you the medicine, and if perchance someone died, they were wrapped and shrouded in white and disposed of. This has been the modus operandi. It didn't take long to see the truth, but this is something that must not be forgotten even for a moment. This is our biggest enemy. Enemy is not the virus, but the game behind it. Today we need Netaji Subhash Chandra Bose ji. You can be Netaji Subhash Chandra Bose. Already many Netajis have taken birth in the country. Advocate Nilesh Ojha is amongst them. Johan Tengra is one too. There is Dr. Devendra Balhara, journalist Karmu Dharmu, Manas Samarth, or Dr. Avdesh Pandey, Dr. K.V. Tumane, Dr. Tarun Kothari, Acharya Manish, Dr. Khadar Wali, Dr. Amar Singh Azad. So these are, I believe, today's Netaji Subhash Chandra Bose, today's Bhagat Singh. In such challenging situations, they risk their own lives, their own selves, and strive to bring the truth to you. Dr. Nilesh Patil from Maharashtra, who worked hard to make sure that you know the truth. Ashok Patel from Gujarat. They are today's Subhash Chandra Bose. They ventured forth all alone and stepped out of their homes. Prakash Pokhriji, who runs a big newspaper, owner of the sole newspaper that published the truth and delivered truth to people. This is a big achievement. Sakha, who is a well-known personality of Bharat, India, he used his network to deliver truth to you. What a big thing this is. So today, The country needs Subhash Chandra Bose, but in order to be inspired by him, go back and remember his achievements and deeds again and again, so you can be constantly encouraged and act bravely. Our enemy today is not standing in front of us with a gun. Our enemy is fear. And what is that fear? It is fear of disease. It is fear of death because of disease. So if fear is disease, then the right weapon to tackle it is knowledge. So through this session, I want to equip you with that knowledge which will rid you of all fear of disease. If you are in a jungle and face a lion, you will be scared. But if you are protected, have a shield or a gun, then even if the lion is ferocious, you will not be scared. So what I want to say is that whatever be the situation, we feel scared only when we don't have clarity, when we think we are weak and can be defeated. So our intention today on January 23rd is to deliver you freedom from fear. Freedom from fear. We wish to give you freedom, because today our enemy is, what has been created is disease mongering. Not disease, but fear of disease, the impact of that. So to free us from fear, knowledge is necessary. Look, two kinds of illnesses can befall us. One is infectious disease, and we demonstrated clearly to all those who contacted us that whatever be the disease, infectious disease, be it typhoid, tuberculosis, or so-called HIV, they can all be treated in a matter of months, days, or even hours. In most cases, people recover in 72 hours. Many of you know this, and those who don't, I will say to them, thousands of people have posted their testimonials, their successful recoveries, and even though YouTube videos have been deleted, they still exist. If you wish to see these testimonials, then you can follow this link. These are stories from different cities across the country. Thousands and thousands of testimonials. Thousands of people cannot lie. We also invited officials from the Ministry of Health Department to come and look and investigate our N.I.C.E protocol. N.I.M, Natural Institute of Naturopathy, Ministry of Ayush, took the initiative and visited our Ahmednagar COVID Center. Please go watch in the link provided, and you will see whatever kind of flu it is, whether it is COVID or whatever name, it is very easy to recover from it. You have one weapon in your hands, and with this weapon you can easily defeat infectious disease. And there are numerous thousands of examples in front of you of that. And this all comes under N.I.C.E. If you feel scared and if you face the first symptom of the flu, we guide you and have been doing so for a long time. We take responsibility and are with you. We take responsibility and are with you. We have nice experts in practically every district of the country. They are all with you. When a person falls sick, there are mostly three reasons for that. One is infectious disease, and we have seen very well how to overcome that. The second is lifestyle disease, like heart disease, hypertension, obesity, thyroid. So to rid you of disease or the fear of disease, and to rid you of various drugs and treatments and medicines that surround the disease, we launched last year what we call W.I.S.E, Wellness and Inflammatory Syndrome Expert.
Wellness and Inflammatory Syndrome.
Here one has to understand whatever be the lifestyle disease, whether it is diabetes, cancer or heart disease, the core or root cause is one, and that is inflammatory syndrome, meaning that the body has inflammation in different places. And when that inflammation is corrected, the disease gets corrected. And you did exactly that. You embraced DIP diet. Several thousands just embraced DIP diet themselves and corrected and healed themselves. And we learned about them when they shared their video with us. And many of you contacted us via the Biswaroop.com/WISE website connection. You shared your symptoms with us. The WISE experts connected with you, designed customized diets, motivated you a little, followed up, and freed you of diseases. So this is also a category of patients. In the beginning, both these services were offered for free, but our NICE experts described a strange situation they encountered. They shared that many times they would design customized diets for patients using their time and effort, but they were not acknowledged and valued properly. Then we decided that we would send the customized diet plans only after receipt of a nominal and token payment. Sometimes forms were filled mischievously, and diet plans that were worked upon with great effort went unacknowledged and unused. So we decided to keep a token amount of 500 rupees, which is not something that we want to earn from you, but just to put in some discipline and seriousness. It is not coming into my pocket, but going to the wise expert who is putting in his or her effort. You can also become a wise or nice expert. You can get that training as well. And then whatever be the illness that you face, whether it is infectious or lifestyle disease, you will learn and know how to tackle it. But if you don't want to learn or want to learn it for free, there is another way. If you go on this link, Corona Kaal TV, I have made several short videos which will help you learn. If you don't like watching videos, then you can learn reading my books. Our books are mostly free, our videos are free. However, if you want a professionally trained program, you can enroll in the 3-month online certification program of Advanced Nutrition Therapy, offered by Lincoln University. So now we come to the most important part of today's session. We have attained health freedom in 2 ways. One is infectious disease and one is lifestyle disease, WISE. Sometimes it may happen, even though seldom, that a complication arises. We might be stuck with 3 or 4 diseases. We might have diabetes, hypertension, and kidney failure. In this situation, it becomes difficult to handle virtually. It may not be possible. Those are patients I oversee personally at HIMS Hospital, Dera-Bassi, and in HIMS, Jaipur. Look, it is not my intention to drive you into one of these 2 hospitals or to the 3rd one which we are going to open soon in Jodhpur, or that you contact us through our virtual OPD. This is not our goal because we cannot treat the entire country. And we don't want to open thousands of hospitals. So we want to give you the knowledge of those simple treatment protocols that are so simple that you can use them in the comfort of your own homes. With that intention, on 31st October, we launched Postural medicine. We can make kidney patients, kidney diseases, dialysis and transplants obsolete. I want to tell you whatever we launched. For example, NICE protocol, N.I.C.E, Ministry of Ayush, observed it and recommended it. DIP diet was observed and studied by All India Institute of Ayurveda. They approved it after doing clinical trials and declared that DIP diet does indeed work. When we launched Postural medicine, our grad system, which benefited many kidney patients, our bathtubs that freed people of dialysis, lots of universities expressed interest in our system. Many professors visited our hospitals, and I'm very happy to share this with you that on the basis of this invention, a university has offered me an honorary doctorate. I will not reveal the name of this university because in the past, whichever university has coordinated or cooperated with us or honored us, that university invariably gets into trouble. Groups that suffer or are hurt when people get free of medicines, be it some corporation or pharmaceutical company, those people get behind these universities and make their existence difficult. So I will not tell you the name of that university. I want to tell you that whatever it is that I have shared with you so far, number one, they are all scientific. and proven. And number two, they are all such that you can actually do it in the comfort of your own homes. Without spending a lot of money, we are clear that you can get health freedom only when you are empowered. You should not be dependent on me, and if you are, it should be minimal, and slowly that dependency should fade away. Whatever I know, if I transfer that understanding to you, then our goal is achieved. If you have health freedom, nobody will be able to scare you. Today we are surrounded by terror. There is curfew at night, or a weekend lockdown is imposed, or you cannot step out without wearing a mask, or you have to be forced into getting an injection. Only when you have health knowledge can you get rid of fear, and only then in real terms you will be freed. So what better day than today to discuss about this freedom and take this even further? Remember that when you fall sick, there is only 3 reasons that can be responsible for that sickness. Either it's an infectious disease or lifestyle disease, and the third thing that can get overwhelming is emergency medical situation. Suddenly, if someone gets cardiac arrest or heart attack, or gets severe toothache, or an injury happens or a fracture, there are many medical conditions that may rise in which you feel helpless. Forget you, even a big doctor can feel helpless and feel that they need to call ambulance. And even if an ambulance arrives in India, forget India, even elsewhere in different parts of the world, it may take longer than 30 minutes to take you to the point of help. It may not happen in 30-45 minutes, it takes longer time. And in some cases, it may prove fatal if the condition is not addressed in the initial few minutes. Cardiac arrest can be fatal in 4 to 10 minutes. After 10 minutes, a point of no return is reached. And in a severe heart case, patient has to be revived in the first 30 minutes, or there is permanent damage. And if you think you can get medical support in 30 minutes, it's virtually impossible. In this situation, only one person can help you, and that is you. So you have to become a little empowered, have to get some knowledge. And then through P.O.E.M and through this helpline, you and I can connect and handle the situation of that moment until medical help reaches you. So it is clear, after any type of medical emergency incident occurs and before help arrives, the time in between these two, this gap has to be maximized and has to be dealt with in the most efficient manner possible. So the patient receives the minimal injury and the chances of revival are maximized. And in order that you do not panic and know exactly what to do, I have studied intensively the different situations and medical conditions and listed them out. There are 55 such conditions that require immediate medical attention. It can be a pain or injury or perhaps a stroke. It can be an attack of some kind. So for all these situations, you need to be in a state of preparedness, irrespective of where you are. That preparation let us launch today, January 23rd, 2022. What can be a better day than this? The new power, that is the power called Protocol of Emergency Medicine, P.O.E.M. A life should flow like a poem, right? With some melody and rhythm rather than being an abstract sentence. So if you have this poem, you will not be afraid in any situation. When we will die is not in our hands, it's in God's hands. But what is in your hands, the best possible knowledge, that collection I strive to get to you. The best of my knowledge, and it is not my collection. This knowledge exists in our literature, and that is what I am striving to get to you. Our medical team, consisting of allopathic doctors, Ayurvedic practitioners, acupressure, acupuncture, and other therapies, even physiotherapy, this entire team has come together and designed this protocol. This common protocol is followed in HIMSS hospitals, in HIMSS Jaipur, HIMSS Dera Bassi, In Punjab, even the virtual OPD patients that we guide, in situations of medical emergency, the protocols that we share with them is what I am going to share with each one of you today here, so that when you face an emergency, you're not disheartened, but can take it immediately in your command, because every minute and second that time is valuable. And if you're failing to do something, it will damage the patient. And if something needs to be done, what exactly is that? If you know that clearly, you can provide a lot of comfort to the patient and can alleviate the distress of the moment and perhaps get rid of it completely. So how this needs to be done is very simple. By adopting what we are launching today on 23rd Jan, be a part of P.O.E.M, Protocol of Emergency Medicine. What do you need to do? It's very simple, only 3 steps. You can achieve in 3 steps. Let us talk quickly about these 3 steps. Step 1 is very simple. You have to go on this link biswaroop.com/P.O.E.M and download this entire list. Take a printout of this. Download it and take a color printout. Put it on a strong backing and hang it somewhere in your house. This is the first step. I am sure you will not have any problems doing this first step. Even if you're traveling, I would recommend that you keep this board in your car, or you can even fold it and keep it in your pocket. So this has 55 different medical conditions, and how to manage it is all written clearly in this. And how you have to manage is even simpler. In order to do that, and I hope, God willing, you don't need to ever do it, please try to remember this number, the number which is here. Please dial this number and we will help you, but we will be able to help you only if you have this protocol list, this poster. We will then video conference, but this poster should be in your hand. We will give you the directions that you need to follow, but this should be in your hand. If you have the poster, you will have access to the number as well. It's the same number that I shared earlier with you. We have one helpline. So even if you have an infectious disease, I am with you. If it is a lifestyle disease, I am with you again. And I am with you in an emergency medical situation also. Remember, we can only make the effort, but the results are in God's hands. I am not promising you anything or giving an assurance, but I am assuring you that my medical team and I are with you 24/7. That is the assurance I am giving you. If you have faith on me on this, you can take my suggestions. That is up to you. Right? I'm also saying that this may or may not be the replacement of the standard or routine protocol. This is different from that and is given as a replacement. But if you have faith in natural therapies, then you can choose this. That is a disclaimer for you actually. So the first step is that you have to download this and keep it like this. Because whenever you call us on the emergency line, for any emergency situation, the first thing you will be told to do is to take out this poster. If you cannot, then you are not part of our P.O.E.M group. To be part of this, you have to subscribe to these steps. The subscription does not require any money. It is offered for free, but you need to do only one thing. You need to have this, and if you have the printout, you would have completed the first step. Now let us proceed to the next step. The second step is very simple. Here I would like to use an example to explain. Imagine you are driving a car and crossing through a jungle. You know nothing about the car, but unfortunately you get a flat tire, a puncture. At that point, you call your mechanic to ask how to fix. And the mechanic asks you to follow his instructions as he tells you. He asks you to open the car's trunk and take out the stepney and other tools. You need to have the tools. If you don't have the tools or the stepney, then the best mechanic of the world cannot help you. You need to have the basic tools, the basic things, even if you don't have the skill. If you have the tools, then through video conferencing, the mechanic can guide you on how to take out the tools and how to use them, how to unwind the nut bolt, etc. The point here is that in an emergency, in a medical emergency, you need to have some basic tools which will be required. They can be called tools, materials, or kitchen items, using which you can help any person based on what they need at that moment. You can give them comfort and help revive them. So all the materials that you will require, you need to have, and that's your responsibility. Just as if you're driving through a jungle, it is your responsibility to have a stepney, a jack, and all the other tools. Right? So then as a mechanic, I can explain you in a video conference what you need to do, how to use and apply these tools and items. To handle any medical emergency, the basic ingredients, the drug-free ingredients, the items from the kitchen that will work as medicine, the list of these items has been described in this column in the end. So all the items that are there on this list, you must have them available. I want to tell you that these items are very simple and are normally there in the kitchen, but you have to keep them separately in some place, carefully, because in a situation of panic, our mind ceases to function fully. We become scared and can fail to find the simplest of things. But many times these simple things can be life-saving. You all have witnessed in the last 2 years, especially in the last year, there were people whose SpO2 levels, oxygen levels dropped to 70%, 60%, 50%, up to 40% also. And we revived them and successfully revived them without a single death, just by keeping a small fan, a small 150 rupee fan in front of their nose. After inclining and bending forward, you know that already. That 150 rupees fan was a life-saving instrument at that point. There were also people failing to find a bed in a hospital, looking desperately for ventilators. And there were people who used this 150 rupee fan effectively. So what I'm trying to say and emphasize is that very simple things and things from our kitchen can be life-saving for you. These are mentioned in this list, and according to that, you have to collect them all. So now let us move to the second section of this program. In this section, you will learn about all these items that you have to collect. Only if you have these items, you will be benefited. Welcome to Protocol of Emergency Medicine, P.O.E.M. There can be many medical conditions where we cannot fathom what to do. We fail to know what to do. For example, what if someone gets a heart attack? What will you do? If someone has a cardiac arrest, what will you do? Or if there is a bleeding nose, what will you do? If someone falls unconscious, what will you do? So in situations where you fail to understand what to do, you end up doing one thing, calling an ambulance, taking the person to the hospital, whether we are in India or anywhere in the world. To get emergency service and to reach a hospital takes time. It is normal to take 30 minutes to an hour to reach the hospital. But it is the initial few minutes that are crucial, especially when someone is experiencing a cardiac arrest. In this, the initial 3 to 4 minutes are important. After this, whatever else you may do may fail to revive the person. You have to give attention to the person immediately. In this situation, only one person can save yourself or the victim, and that is you. So it is advisable that you strengthen your knowledge and equip yourself with the right tools so you can help yourself and someone else. When you need help most, it is you who's closest. But what do you do at that point? So you must be thinking all these household items in front of me, they are actually miraculous. They are miraculous ingredients, and you can use them as medicine and can pull yourself out of emergency situations or even help someone else. You can get results not like but even better than the hospital. 99% of medical emergencies, especially ones I have experienced, 99% of the time we can give relief to the patient right in the house, better than the hospital. This is what we did in the last 2 years. Through N.I.C.E, Network of Influenza Care Experts. We have 750 N.I.C.E experts throughout the country. We connected with people through the N.I.C.E helpline. And flu or COVID, whatever name you choose, we helped everyone with this condition while they were at home. We also helped them in our COVID center in Ahmednagar. And we used these very items I'm sharing with you now. For example, as you noticed, in breathlessness or when the oxygen levels fall to 70%, 60%, or even 50% or 40%, they would be taken to a ventilator, a 10 lakhs rupees machine, which could still fail to save the person. Finally, the patient dies. When in fact, we have a very simple home-based treatment for this condition that can help a person with even 40% SpO2 levels very effectively. We helped many such people who connected with us through our helpline. There are only 2 steps you need to take to help such people. Number 1, prone ventilation. You lie down on your stomach. Number 2, this is a small fan. This fan, it costs about 200 rupees. Keep the fan in front of the nose, lying in prone position, or while seated in a chair and leaning a little towards the front. When you change your posture and use the simple tool, it works very effectively, better than oxygen cylinder and a ventilator. We treated 60,000 patients, and the tool we used, even in our COVID center, which had 1100 patients, the tool was the small fan. To those who had fever, we did not give a single tablet of paracetamol. When the temperature would rise over 102 degrees Fahrenheit, the tool we used was this towel. We would wet this towel and keep it on their forehead, on their arms, on their legs, on the calves, and wrap them in these cold, wet towels. Using these very simple things, we treated all our patients. And no one died, not a single death, no mortality. We did not need to give any medicine to any patient. And most of the patients recovered within 7 to 10 days. Right? And many of them would actually recover the 3rd day. 95% of them, 80% within 7 days, and 1 to 2% who took 10 to 12 days to recover. All achieved with these small tools. Whether we talk of flu, low SpO2, fever, or heart attack. Now look here, this piece of ginger looks very simple. There is hardly a house which does not have ginger. If a patient has an ongoing heart attack, is sweating profusely, is experiencing excessive chest pain or high BP, in this situation you have to do just one thing. Give the person a piece of ginger. He needs to chew it constantly. Keep giving it till you see tears in the eyes. As soon as you see tears flowing from the eyes, it means there is enough nitric oxide produced in the body now that can help control the heart attack. Even halt it right there. If the person gets unconscious, now you have to use these green chilies, and this will work. Make a paste of it and keep it under the tongue. That can help in bringing the patient back to consciousness. Which home does not have these things? This is our medicine, our pharmacy. We can make medicine from these things. But when such a scenario arises, we lose our confidence and fail to understand what we need to do. And in this situation, we are with you through P.O.E.M, Protocol of Emergency Medicine. In 3 steps, you can connect with me. Step 1. Go on the link provided on the screen and print out this poster. Keep it safely somewhere in your house. Step 2. All these ingredients, they have been provided in a list in the last column. Please buy all these ingredients and put them together. Take a picture of yourself with all these ingredients and submit it in the link provided on the website. That becomes step 2. The final step is OEM, Orientation of Emergency Medicine. All this is your emergency medicine. But to use it well, you need orientation. You need to get an idea of how all these work. You need to understand a little bit on how to handle it. We are there with you, of course, but you need to know a little bit too. Have a little bit idea of it all. For that, we have the orientation of emergency medicine. What is your emergency medicine? All these household items. We will send you a video of this orientation, and that becomes your 3rd step. And on completing it, you will be connected to us. Whatever be your emergency situation, till you are waiting for an ambulance or to reach the hospital, In these golden minutes, you can provide comfort to the patient and make the person feel more secure. Whatever be the problem in the patient's body, whether it's an injury or pain management, you can provide relief to the person. So the person's situation does not worsen and in fact stabilizes. In those moments, we will be there with you through video conferencing. You need to simply remember that there is a helpline number which is here. You need to call us on this helpline. You don't need to have the complete knowledge. You just need to have all these ingredients present in your home at that point. And keep this number handy. And when the emergency situation rises, you just call me on this number. Our medical team will be ready for you. They are available 24/7. They will answer your call immediately and will start video conferencing. And looking at the patient's condition, we will keep guiding you. Which ingredient has to be used in what way? And accordingly, you will follow the instructions. Meanwhile, other members of your family could be calling the doctor or the ambulance. But we are trying to give comfort, right? So in this manner, you and I will be connected. This is a free service. The only condition is that all these items which you normally have in the house be present. This is an automatic defibrillator. It costs about 1 lakh to 1.5 lakh. You may not get it at this point. It need not be there in every house. It's better if it is there on a community basis. Perhaps many people can get together and buy it. This is an investment of 1 to 1.5 lakhs and may be kept aside for the moment. The other item is a bathtub. It can be made at home for 20 to 30,000 rupees. But if you think it's a big investment, you can keep it aside for now. But all these other items you can buy easily for between 8 to 10,000 rupees. And you will easily find them around your house. What I'm trying to say is that if you want to connect with me via P.O.E.M, and God forbid you may face a situation or an emergency condition, at that point I'd like you to feel empowered. You should be in a position to help. And God forbid if you were to face that situation personally, you should be able to help yourself. For that, you have to prepare right now. And what is that preparation? All you have to do is to collect all of these items one by one. And after that, you have to take a picture of yourself with these items and submit it on this link provided. And then we will send you a video orientation of emergency medicine. And after watching that video, you will get the confidence on how to use these items. You don't need to remember each and everything. You just need to develop a familiarity. That's it. And make sure that you have this number handy. And then you're ready with the P.O.E.M. You're ready for protocol of emergency medicine. These things look very simple, but they work miraculously. Say for example, a simple item here is this brick. If you get a chance to visit our HIMSS hospital, where you will see many people who have come here after spending thousands of rupees in other hospitals, in order to reduce their blood pressure and to increase their urinary output, to reduce their swelling, we use this simple, easily available, freely available brick. We simply put these bricks on one side of the bed, and patients that lie on this bed slowly experience reduction in their blood pressure. They experience symptomatic improvement, they start feeling better, and their kidney function starts improving. Do you need to go to the hospital for this process? You can achieve the same result in your home. So our goal is that you yourself should become your doctor. Where you get stuck, we are there to help. It is not necessary that you will be close to a hospital or professional help in an emergency situation. So you have to make the preparations yourself to be ready for it, especially in today's environment. People are reluctant to go to the hospital because of the RT-PCR tests that are required. And if perchance it becomes positive, you will need to first get treated for corona. And in the name of treatment, you might be administered toxic drugs. So instead of getting treated for what you went for, you might end up being treated for something else altogether. There might be a condition that the treatment will start only if you are vaccinated. There is just a minor stumbling block between you and knowing what to do in an emergency situation. The solution is to empower yourself, so you can handle most things that perchance come your way. For example, someone might have a severe toothache. So instead of running to the dentist, you might turn to the simple garlic. Just crush a few cloves well and apply it to the area of the pain, and the pain will disappear. If you have a severe headache, you don't need any medicine for headache. You have to use this oil. It's called sniffing oil that we have produced recently. Once made, it lasts for a long time. You don't have to ingest it, just sniff it in both nostrils. You do experience a current-like sensation for a few seconds, but your headache is gone. We distribute these to our friends, but once you enroll in P.O.E.M, we shall give it to you also. You won't find it in any store. I'm just trying to say that a lot of big problems often have a very simple solution. If suddenly someone's blood pressure drops, what do? How do we raise the blood pressure, and that too without medicines? It's very, very simple. Look, this is coffee. Coffee powder is available in most homes. Take 1 cup of hot water and mix in 1 teaspoon of this coffee powder. Drink this 2 or 3 times a day and the blood pressure normalizes. So you do indeed have medicine in the form of food. And you need to get immediate relief. You will find that these do work. These materials work very, very fast. Say you have a situation where a person's blood pressure rises significantly. So what do you do in that situation? The solution is actually very simple. What you use actually a bucket. Fill water in the bucket up to this level. It should be 42 degrees Celsius. Have the patient dip both the legs in the bucket. Let the person sit for about 30 minutes. Make sure that the temperature of the water is maintained at 42 degrees, so you might need somebody to help and keep putting in the hot water. And you will see that in 20 to 30 minutes, the person's systolic, even diastolic blood pressure will reduce by 10 units each. If you sit for 2 to 3 times a day, the blood pressure will normalize very quickly. This means drug-free, and who doesn't have a bucket in the house? If you're confused and don't understand how to do what to do, then our emergency number is always there, ready and handy. So here, what is important, as a first step, you have to print out this document and you have to make available all the items listed, all the ingredients. So let's get familiar with all the ingredients that you need to put together, and most of it you might be already familiar with and have it. Let's start from one side. How you have to use these ingredients has been provided on this page. And you will be provided the training separately in OEM, and we will see that later. But first, let us see what these items are. Starting here, this is an enema kit. And if someone has a fracture, this is a knee and leg immobilizer. So this is a small tool. And next, if perchance someone has a fracture in the hand, this is a sling. Keep this sling also for emergency. This is a fan here. And this is a sitz bath. This is helpful to a piles patient. If you have a small tub, that would work too. Now here is an item that is an important part of the protocol. It's called homeostatic dressing. This is used in a situation where someone has a deep cut and the bleeding does not stop. So this pad, when applied on the area, and because it has a special chemical, it lets blood clotting happen fast, and it will help in stopping the bleeding almost instantly. So in this situation, when someone gets a deep cut in the house and you don't have access to a nurse or a doctor, so keep this dressing handy at home. It is available in different sizes. So all you have to do is to stick it on the area. So that is an emergency to stop the bleeding immediately. This is a stapler. You can actually staple your skin and connect it. You can get the stapler, but you can get the training from our trained doctors through the video. After the training, of course, you can use it. Like this, there are many tools and many things that you can use simply.
These are the cups, right? So
these are cups. They're called suction cups and they are easily available online and they are inexpensive to about 700 800 rupees. Keep this handy and they are useful in many situations like pain relief. They're also useful in snake bite and you need to suck out the poison. This is a TENS machine and it is used in pain relief. How you have to use the TENS machine, we will be able to explain you in OEM. Many companies make it and it's also around 700 to 800 rupees. Now let us move ahead. Now this is an inclinometer. It is not really necessary. They're used in different situations. For example, in a kidney patient, when we make them lie down in an inclined bed, they have to be inclined at an angle of 10 degrees. This tool ensures that the angle is right, it's 10 degrees. But you can even approximate and don't have to use this tool. Let's move on. There are many things. Let's try to move fast. This is limestone powder. This is cardamom, sand. This is useful in potli massage. If someone has a pain in the knee and it is severe, cannot find comfort, keep this small bundle ready beforehand. You will learn the details in OEM, but this sand and rock salt is used to make the small bundle made of cloth. It also has turmeric in it. These are all used to make this little potli or bundle made of cloth. How to make it, we will see it in the OEM video. This is fenugreek, this is desi kapoor or camphor and it's very useful for asthma patients and when your oxygen levels fall. This is black salt and cumin seeds. This is black pepper. These are also some seeds and this is sandalwood powder. These are carrot seeds and this is kalonji, onion seeds, carom seeds, fennel, red chili, this is turmeric, this is cloves, this is rock sugar, this here is coriander seeds, this is alum. Moving on, here is turmeric powder, trifla powder, this is rock salt, dried raisins, dry ginger powder, cinnamon, curry leaves. So how to use these is already provided in this chart and then when we need it according to the video conference and condition of the patient, we will guide you. We assume that you will gather everything and keep it all in one place and we hope that you will familiarize yourself with all these things so that when we need it and when we say that you need haldi, you will know what it is and where to find it. So you must have clarity about these things. If something here is new to you, it will be better if you familiarize yourself with them after you buy it. This here is the bark of arjun, this is mustard seeds, this here is ashwagandha, castor oil, coconut oil, lavender oil, this is asafoetida, amrit dhara. This is very useful especially in pain relief. You can find it easily. In addition, this is jaggery, rice, people tree leaf, neem leaf. Neem leaf is very useful in emergency medicine. We use it in many places. This is arc leaf, this is night jasmine leaf, this is aloe vera. In addition, there is use for fruits also, especially when there is a low blood sugar patient. If the blood sugar drops suddenly, then the safest way is to give fruits to increase the blood sugar. This is cilantro, methi, fenugreek leaves, bottle gourd. So using these things, you will make your own medicine. It will take 2 to 3 minutes to make the medicine and we will tell you how to administer it. This is lemon. Holy basil has a special role. You will see here there are 54 to 55 emergency situations that humans experience, and in many of these situations the juice of holy basil 2 to 3 drops plays a very crucial role. The important thing is though it has to be freshly made juice. It cannot be given out of a bottle, it has to be made fresh to get instant relief. These are the total ingredients. It is important for you to have these and then you will be ready with P.O.E.M. Now you're prepared for the things necessary for P.O.E.M. The defibrillator and the bathtub that I mentioned, you can leave those two out for now. You start with the rest of them. Gather them immediately, as soon as possible, and then go to the second step, upload them with your photograph, and then we shall send you the video as part of your third step. So, in whatever emergency situation you find yourself in, we will be with you. I am with you. Now you are almost ready to become part of P.O.E.M, to avail of this emergency service. So now you have to educate and upgrade yourself a little bit, so that when you are driving and experience a flat tire, and you call me, and if I instruct you to take out the tire from the trunk, so what is the trunk, what is the tire, what is the stepney, at least that knowledge you need to have. Only then I will be able to help you. If you ask me what is the trunk, so you need to upgrade to a basic level of knowledge. This is called the third step, orientation of emergency medicine. In the second step, you have to remember that you have to collect all the ingredients, and then you have to take a photograph and upload it on this site, biswaroop.com/P.O.E.M. This will indicate to us that yes, you have all the materials necessary. Not only are you ready to be a good driver, if by chance you face a flat tire, you are ready to handle that situation as well. This assurance we need, and only then we will register your number with our team of doctors, who is ready to serve you and is with you 24/7, so that when you call us, your number will be registered with us, and only then we will respond to that call. If your number is not registered with us, we will not be able to give it any service. So in order to register your number, you have to complete step 2. It is very simple. You have to collect everything and just take a photograph with them, and then your step will be complete. Our video O.E.M. is a simple and short video. It is a basic orientation that helps you understand these ingredients. O.E.M. is an important part of the training. I believe strongly that every living person should be trained in this, so that every person is able to face all kinds of medical situations, because you are the first person that can help yourself. So you need to have a little bit of knowledge for survival. If you end up in the hospital, you could be misled into thinking that a small condition is a big disease, and you can become drug dependent for life. And here I'd like to give you an example, and this is an important part of the training. When you download this chart, you have to pay special attention to these parameters mentioned at the top. When you need to be calm and when there is reason for panic. Actually, you should not panic at any point. You just have to see the parameters and be alerted. If you think your sugar levels have risen, you have to first understand what is a high sugar level. High sugar is actually not so problematic as low sugar. Often you experience low sugar if you have been taking insulin or other diabetes medicines. Naturally, your body never drops sugar levels even if you have been fasting for several days. So when should you know that you should be in a state of alert? As mentioned, if the blood sugar is below 70, then understand that you need to be alert. If it is over 500, even then you need to be cautious. And as far as your BP is concerned, what is that level at which you need to take action? What is that number that needs to be controlled? That number for systolic is 90. If it goes below 90, it has to be increased immediately. If your diastolic goes over 220, that means we have to intervene immediately and lower it. How to increase and decrease instantly, these are the tips that P.O.E.M provides. These tips will help you take control of and command your own body's parameters. In the same way, we can address oxygen saturation. Last year, many of us would have learned about oxygen saturation for the first time. Something like an oximeter exists would also have been something new. It was over-publicized last year. Remember that when someone catches a flu, it is normal for the oxygen levels to fall. So oxygen saturation is meaningless unless you're having breathing problems. If you have these breathing symptoms and oxygen levels are below 85, then you have to be alerted and take action. So here is how P.O.E.M will be useful, where you have the guidelines for the parameters that you have to look for. And this is where the knowledge of all the ingredients to use will be beneficial. Now let's look at pulse rate. If your pulse rate is below 40, it means that we need to increase it. If it falls below this, it is a danger bell. So these dangerous parameters, if you have an idea of all these danger parameters, you will feel a sense of ease. It is rare that someone's numbers go below or above these danger parameters. 99% of the times they stay within these parameters. So you shouldn't be worried, and you will be alerted only when these parameters are crossed. Then you will follow the instructions given in P.O.E.M. If you are unable to follow directly and scientifically the instructions, you need not worry. You have to just reach out to us using the helpline provided. But remember to call us using the number that you have registered with us. Then the medical team will help and guide you with the ingredients that you have already collected and will be with you till help arrives. It is my experience 99% of the time the patient revives using these methods and emergency aid is not required. Perhaps it is needed that 1% of the times. But you are panicking 100% of the times and you're losing out on that golden period of 30 minutes to an hour before help arrives. So during this golden period, I am with you. All these dangerous parameters, this is what you have to keep an eye on. One thing to note, and it's interesting, is that to observe these dangerous parameters, you don't need any special tool or instrument. If you look at this one thing here, it's called capillary refill test. This test can be done immediately, especially if the patient is unconscious. All you have to do is to take a finger and pinch it like this. Pinch for 4 seconds and leave. And as soon as you leave, you will see that it is white. It takes 2 to 4 seconds for the color red to come back. If it takes longer than 4 seconds, understand that it is a medical emergency. So to know if there is a medical emergency, this is actually a very simple and easy way. Especially if the patient is unconscious. You can do the test even when the patient is conscious. This is the capillary refill test. And there are other such simple tests which can tell you the truth about the existing situation. We have gotten into this habit for panicking if the cholesterol rises, creatinine levels rise, potassium rises, sodium rises. These numbers that I just mentioned, they are not for panicking. Some people may have their creatinine at 20 or 30 but may still be problem-free. On the other hand, a person at creatinine levels 2 may actually experience discomfort. Similarly, someone might be okay with potassium level 8 and another may not be okay with level 5. So we cannot relate these. So the factors that we can relate to a person's physical symptoms are these listed out on the chart. These bits of knowledge will prove very useful at the right moment, in the time of emergency. This is what we call as orientation of emergency medicine. We will send the video to you. After you watch the video, that video will empower you. The material that you collected, the knowledge that you collected, and this helpline, together when there is a need for medical attention, we will not sit helplessly, not just wait for the ambulance to arrive. That time, we will engage in positive action. We will be engaged in reviving the patient, in giving comfort to the person. So his injury is minimized, the damage is restricted. That is the direction that we shall work in together. So I'm hopeful that now after N.I.C.E, after W.I.S.E, we have P.O.E.M and we complete the cycle. Whether it is infectious disease or lifestyle disease or medical emergency, you will have to take some initiative and become knowledgeable. To increase your awareness, especially for emergency situations, I will suggest here that you enroll in our 2-month online certification training program called P.O.E.M, Emergency and Pain Management. We have P.O.E.M paramedics throughout the country, about 1,000 of them. Some of them, about 700 of them, shall be getting the certificate at the end of this month. If you would like to learn this in detail professionally so that you feel more confident and can handle any situation and anybody confidently till emergency aid can arrive, then you can do this training program and get the certification. But if you would like to learn all this for free, then there is a way. You can go online and check out all our videos on coronacall.tv. We will be posting more videos there, and of course you can check out this video OEM that we shall send to you. I will also urge very strongly to read this book 360-degree Postural Medicine. This is already a bestseller for many months. It's been a bestseller since October. The book is both in Hindi and English, and when you read it, you will see that there are very simple solutions to difficult situations and problems, all achieved through postural medicine. So there are many drug-free solutions that can help us revive a patient. There are many drug-free solutions that can give comfort to a patient. And there are many drug-free solutions that can make a difference by your presence, which only require a little bit of your presence, your knowledge, some skill, and you can make a big difference. So I do hope that you will acquire this knowledge of P.O.E.M and spread it to others, so that the panic that people experience is reduced. So recall the situation 2 years ago when a lockdown was imposed and everything was shut down, and the panic escalated many times over. Even that situation came when all the beds in the hospital were taken and filled up. So you had to pay 1 lakh to 2 lakh rupees for a bed. Why not we make our own house our hospital? If you have all the ingredients that we have just discussed, then we can manage most of the situation ourselves, and very successfully and without causing any hurt to the patient. And this is what I call health freedom. Today, 23rd January, I would like you and I to make a promise that we will spend a little time trying to create awareness in people on attaining health freedom. This knowledge on health should not be limited to some privileged people. It should not be limited to doctors only. Every person has a right to this knowledge, because it is only with the help of this knowledge that the fear, which is instilled in everyone through the medium of television and newspaper, we will then be liberated of that fear. And that is the real freedom. Only then you will be able to think of something new for the country and the world. You cannot be living in constant fear and think of something new. So hope to meet you soon. All the best and Jai Hind.